Here I am with Stefano Gracis. This is the Florida Academy of Cosmetic Dentistry's 2012 Annual Scientific Session and Trade Show, and I've gotten a moment to take away with one of our presenters today who's doing actually an amazing job, and our membership is absolutely loving our presentation today. Now, Stefano, what is the main takeaway message, the most important point you would want our members to take away from today?
Hopefully, the fact that you cannot think only aesthetics. I mean, aesthetics is the beginning, there is no question. So if you want to make an aesthetic or a cosmetic change to the teeth of your patient who comes in and maybe asks you to do that, it's all right. I mean, go ahead and make that evaluation. But you have to take into consideration the implications from a functional standpoint of what you're going to make as far as changes are concerned to those teeth. So for sure, I hope that at the end of this day, this message is going to be clear to everybody, and also how to do that. So I did not want to just stress the importance of doing it, but I'm trying also to explain how to do that, how to evaluate that, how to communicate these changes to the lab technician, and how to test it on the patient, and how also to involve the patient in all of this process. It's very, very important, because if you have a patient who understands and collaborates in the development of this new situation, you are more likely to have a success at the end.
I see, it's like involving like the whole team.
Well, we definitely try to have different people involved in this process. So starting from the beginning, the aesthetic evaluation, of course, I carried out in the first part of the treatment. But then, in many cases, not all of them, of course, I have the dental technician come in and look at the patient with me live. Of course, we're taking a lot of pictures. We're starting to take more and more videos. We are using a protocol for sharing pictures and videos, so that there is a static and a dynamic analysis of the patient way of smiling and speaking and appearing. And the contribution of these people is very important. When orthodontics is involved, the orthodontist comes in as well. And we try to discuss openly in front of the patient what we see, how we would change. And whenever there is a doubt, a question, we always try to do a mock-up. Modifying a picture, to me, doesn't do it. You have to see it in the patient's mouth. So the mock-up is a very, very useful tool. It doesn't take much time sometimes, or it doesn't take much of a cost to do it, and it prevents miscommunication, especially when you're doing veneers. You don't have the chance to really try in the restorations, the final restorations. The mock-up, especially if it's an adhesive mock-up, gives you instead that opportunity. So this is all part of the analysis and communication with the patient and with the other team members, so that everybody knows what we're trying to achieve.
Sounds like you have a really unique practice too, and you've got a great collaborative approach going on with the specialists and with the patients. Tell me a little bit more about your practice in Milan.
Well, I feel very, very lucky because I have found about 13 years ago a colleague, he's 5 years younger than I am, with whom from day one there was a very good communication, understanding, and a common view of how to develop the practice. So we decided to team up, and we are partners, equal partners in the office. He is responsible for all the surgical side of the treatment, so periosurgery, implant surgery. He also, and this is maybe a little unusual in the States, but this is not so unusual in Italy, he also deals with all the endodontic part, while I am responsible for all the prosthetic part. Then we have a collaborator who does the operative dentistry. But having on a daily basis a partner with which there is such a good understanding, and I tell you, in 13 years, we have never had one argument, which is quite amazing, allows us to really develop our skills and improve our skills and knowledge. Every day we are there looking at patients together. Anytime I have a question on how to proceed, I call him, he comes in, or he calls me and I go in. And then we discuss the cases when we have a new patient coming in. So maybe the new patient will have the initial visit with me or with him. But then, depending on the situation, I will call him or he will call me. And then in the evening, we sit down with the extras and the pictures and everything to draw the treatment plan. Anytime there is then the need for orthodontics, then we have an outside orthodontist with whom we collaborate. He's actually American because he graduated from Harvard ortho program many, many years ago. But he met an Italian lady, married her, so he moved over in Italy. So for the last 15 years, we have been collaborating with him. And once a month, we have a meeting with him as well. And having these three people sitting around the table discussing cases on a regular basis, and very often the dental technician will participate in these monthly meetings, gives us a very wide approach, an open approach to the treatment where everybody is able to bring in its own competence and suggestions. To me, orthodontics is so important to integrate in any practice. It enhances the result of what we can do, it decreases our invasiveness, and it improves the quality of what we're doing. So we really do that on a daily basis.
You notice that's another good takeaway point. You do incorporate a lot of orthodontics in your treatments and in your cases. I did notice that from the presentation today.
Yeah, I do that a lot. Almost, I would say, 90% of the patients who come to my attention, I certainly take into consideration the orthodontic option. I'm a fairly good convincer. I mean, I convince a lot of the adult patients who go through. Sometimes I find the hard one who will not be convinced, and at that point then I have to follow the restorative route. But to me, ortho is so important. The multidisciplinary approach is really our daily bread.
That's great. So another question, where do you see Gracis going in the future, man? What do you think is next? What do you think's next for you? Based on the last 13 years and how far you've come in your career, what are you looking forward to in the future?
I just see more of what I'm doing, but at a higher level. Looking back, since I came back from the States, as I mentioned, it's 22 years now. I have changed so much in so many ways, and most of it has been because of the courses that I was asked to give and lectures I was asked to give. I hope I will keep on having this opportunity, which has brought me all over the world and has allowed to meet a lot of very interesting and stimulating people all over the world again. I hope I'll have this opportunity because that's the only way for me to really improve. You know, giving a course, you know that, it makes you very motivated in providing a high standard of care every day. And the fact that you're going to be showing your work to other people really makes you be very strict with your protocols, with your approach, with the standard of quality that you want to deliver to your patients, and also improves the knowledge. If you have to explain to somebody what you're doing, you really have to have a full understanding of that. And through this interaction with your colleagues, you know, this is where definitely I have found the way to understand much more and improve myself. So in the future, certainly I'd like to do more of that. I love teaching. I never give the same lecture twice. There is always something, you know, even today from the interaction with your group, I already have had some feedback, and more I'm sure it's going to come this afternoon, to even improve the communication of the concepts that I'm trying to lay out. And maybe, you know, reaching a wider base of people. Certainly, I have to thank my mentors, the people that I met when I was here during my education, especially at the University of Washington, but even at the University of Pennsylvania. They really opened my mind, they opened my world in many ways, and I like to give back something to the profession through this teaching activity and opportunities.
We certainly appreciate all the time and the effort that goes into putting together a presentation like the one we're hearing today, and we really appreciate you flying all the way here from Italy to Orlando to speak to us. You know, it's been a pleasure, really a true pleasure. I think your group, especially in many ways, from what I saw, the energy in the group and the warmth of the group has been really very, very good.
So I wish you and your group lots of luck. I see that you have very good ideas. Even the program that you have set up for next year, it's bound to be an extremely interesting program because of the people who you have invited. So, with these people as mentors, as stimulus for your everyday practice, I think we are all bound to increase our skills and improve the quality of life of our patients.
Thank you very much for your time today.
It's been a pleasure.
Thank you.